go.
Type 1 diabetes is a disorder when the body does not produce enough insulin. It results when the pancreas loses its ability to make the hormone insulin, or the person's immune system attacks and destroys the cells in the pancreas that produce insulin. This could lead to the malfunction of other organs and kidneys. Since insulin is normally released in response to a high blood glucose level, the glucose in circulation does not get taken up by the liver or stored as glucagon for later use. Insulin regulates the level of glucose in your body. It's absorbed by your body as a natural part of the digestion and is carried around your body. Insulin helps your body produce glucose when your body can't. Type 1 diabetes is genetic, and some of the short-term effects are that it can make you thirsty, hungry, and have excessive urination and hypoglycemia. Some of the long-term effects of type 1 are diabetic retinopathy, kidney disease, diabetic neuropathy, and macrovascular problems. These involve your eyes, kidneys, nerves, and your heart. Since type 1 diabetes is genetic, there is not really a possible way to prevent this disease. To help improve your diabetes, take your medication, schedule a yearly appointment, do not drink, smoke, or do drugs, maintain a healthy diet, and keep your blood glucose level good. These treatment options can help maintain a blood glucose level to stay normal. Some of these treatments can help more than others. The number one treatment is putting insulin in your body. Therefore, your body can produce glucose. Other treatments such as oral medication will help maintain a good glucose level. Type 1 diabetes cannot be prevented because it is.
Hello, Caroline. I have your test results back. Because of your systems of excessive thirst, hunger, and urination, and low blood glucose, your test results show that you have type 1 diabetes.
What's type 1 diabetes and why do I have it?
Type 1 diabetes is genetic, so either your mom, your dad, or a relative have had it before. This is a disorder when your hormones don't produce enough insulin. This is a result when the pancreas loses its ability to make insulin. Your body's immune system is attacking and destroying the cells that make the insulin.
Is there any way to get rid of it?
There's no certain way to get rid of type 1 diabetes, but there are some responsibilities. You need to make sure that your blood sugar is low or on task. You take your medication and do not smoke or drink.
Okay, thanks, doctor.
Type 2 diabetes. A form of diabetes where either the body doesn't produce enough insulin or the cells ignore the insulin. At the cellular level, type 2 diabetes can cause insulin receptors to be less sensitive, or it can cause abnormal beta cells that won't signal the pancreas. The body needs insulin in order to use glucose for energy. When you eat food, the body breaks it down into glucose. Insulin would normally then attach to a cell's insulin receptor, which would signal chain reactions, including the GLUT4 reaction. GLUT4 moves to the cell membrane and creates channels which load the glucose in the cell. But with type 2 diabetes, insulin isn't produced, or the cell receptors don't take it, which then causes glucose buildups in the blood. The two most common causes of type 2 diabetes are obesity and lack of physical activity. Other causes include when the pancreas does not produce any insulin, when the pancreas produces very little insulin, and when the body does not respond appropriately to insulin, a condition called insulin resistance. Symptoms include increased thirst, increased hunger, dry mouth, nausea and occasional vomiting, frequent urination, fatigue, blurred vision, numbness or tingling of the hands or feet, frequent infections to the skin, sores that are slow to heal. Doctors will look for abnormalities in your blood, hemoglobin tests to reflect your blood sugar. Short-term effects. The most common short-term effect of your blood sugar. Short-term effects. The most common short-term effect of type 2 diabetes is hypoglycemia, which is low blood glucose or blood sugar. Symptoms of hypoglycemia include rapid heartbeat, sweating, anxiety, numbness, sleepiness, confusion, headache, and slurred speech. Long-term effects. Microvascular, which means small vessel, disease, causes changes in the capillaries or every organ in the body. Other long-term complications include diabetic retinopathy, diabetic nephropathy, diabetic neuropathy, and foot problems. People with diabetes are more likely to develop infections than non-diabetics. Anti-hyperglycemic drugs are available to help people with type 2 diabetes control their blood sugar levels. Metformin is a safe and effective drug that reduces glucose production in the liver and makes tissues more sensitive to insulin. Oral drugs that stimulate the pancreas to release insulin.
Hello, Brady. Why are you here today?
Well, lately I've been really thirsty and really hungry.
Oh, well, that could be many things. Have you also experienced blurred vision?
Yes, my feet have been numb.
Okay, I'm going to do some blood tests because I think you might have type 2 diabetes.
What's type 2 diabetes?
Type 2 diabetes means that your blood doesn't produce enough insulin or the cells in your body ignore the insulin. This will cause you to have glucose buildup in your blood. The most common causes of type 2 diabetes are obesity and a lack of physical activity.
Well, I do know I'm overweight.
Your blood tests have proved that you do have type 2 diabetes. The most common short-term symptoms is hyperglycemia, which may cause you to have a rapid heartbeat, headache, and extreme sleepiness.
What are the treatments?
We can provide you with an anti-hyperglycemic medicine that will reduce glucose production in the liver and lower your overall glucose level. Also, behavior and lifestyle-wise, you can have a healthier diet and increase your physical activity.
Okay, thanks.
As you can see, both of our patients had a type of diabetes. Patient 1 had type 1 diabetes, which is more genetic, whereas patient 2 had type 2 diabetes because of her unhealthy lifestyle and being overweight. The comparison between type 1 and type 2 diabetes is that they both need insulin to produce glucose for their body. Hopefully this video has helped you understand the difference and similarities between type 1 and type 2 diabetes.